All right, everybody. Now getting to the pharmacy technician. So it's chapter 2. So you'll find this presentation in your readings and tools as well. All right, so we'll talk about the difference between the technician and the pharmacist, some of the standards, HIPAA, we'll get into OSHA, a training to be a PT, and some certs. Not too bad. So pretty basic training, different types of training you can do. Community college, like ROP at Grossmont. Career college, just like our school here, CCSD, or any of those 7-8 months diploma schools. Or in some states, just on-the-job training to become a pharmacy technician. Pharmacists. So in California, for every one pharmacist, you're allowed 2 technicians that you directly supervise. So they're going to be a tremendous help to the pharmacist. You can have as many clerks as you want in that ratio. Technicians, you can only do what you're trained for, whereas the pharmacists, they're going to be the expert. So they are going to be able to do tasks that techs can't. So the main one is drug counseling, interpreting data just like lab results. If you run any clinical tests, they can't adjust. Techs can't adjust dosing based on that. We're not taught to interpret data. Don't just think of community or hospital, like I mentioned. Closed door, compounding, IVs, home care. Those are other pharmacy settings available. And then depending on the setting, you might need specialized training or experience. So especially in the hospital, it's probably a little bit harder to get into the hospital than retail. All right, techs, you're going to take in prescriptions. You're going to take in patient info. All right, techs are able to prep the meds, compound drugs. So in order to mix drugs, you have to be a tech or a technician. Nurse, doctor, they can't mix drugs. Work with professionals, enter professional or prescriber info. What is this? Packaging and receiving, definitely. Inventory control, usually linked with your register system. And then this is processing the script. So again, in COM 103, you'll actually do the prescription reading and processing. So that's why you have to know SIG codes. Doctors will use abbreviations. They don't have time to write out the entire directions. Which task can only be done by the pharmacist? Can a technician do A? Fill prescriptions? Yeah, technician can fill A. Can a technician counsel patients? Technicians can counsel? No, only a pharmacist can. Yeah. So an MA, they're going to have to do patient education. So that's different scope of practice. In pharmacy, that's going to be a pharmacist task. How to take the meds, what side effects to look out for, refills, etc. MAs, you do that for patient education. In pharmacy, it's the pharmacist. Can a technician compound? Yeah, only a technician and pharmacist can mix drugs. Can a technician take in prescriptions? Yeah, right. Patients come to the counter, we take that in all the time. Can a technician interpret data? Technician? No. Remember, this is only by the pharmacist. So what a pharmacist can only do means the technician cannot. Technician cannot counsel patient. A technician cannot look at lab results, x-rays, and then no, that's directions. Okay. Interpreting directions, you have to know. I teach you how to do that. That's your task. Okay. I'm never going to say, hey, these are the glucose levels in the blood. We have to adjust the dosing. I'm not going to teach you that. You're not going to do that. That's interpreting data. You guys can look up data. You guys can collect data. You guys can enter data. But you can't make any decisions based on the data. Can a technician take a phone, a verbal refill order? Refill over the phone. How about a new prescription? Refills you can. What changes on a refill? Nothing, right? Nothing changes. Is the drug the same?
Yes.
Is the strength the same?
Yes.
Is the directions the same? Is the patient the same? What can go wrong? Not too much, but everything's the same. But on a new prescription, what can go wrong? Pretty much every detail. So only the pharmacists were able to take verbal new orders. Refills, technicians can. Because you're just looking up, it's already in the system, just give them another fill. But if it's a new, too many things can go wrong, pharmacists only. So those are the three main things: counsel, interpret data, and new verbal orders. Personal standards. So not only being #1 trusted profession, but pretty high standards as well. So are you guys up to par? Take your own personal inventory. Can you guys work with others? Do you guys help out each other in the in-class assignments? Or are you guys mostly working on your own? Mostly working on your own. So get together, make some friends. I give you guys time to work together. Work together in anatomy and now pharmacy as well. There's going to be math, SIG codes that you may not know, but your friends might know. How's your communication? Always working on it, right? HIPAA. How do you spell HIPAA? How many P's? Hippopotamus? Health Insurance Portability and Accountability Act. So you can change job and keep insurance. Accountability is protected health information. You got to keep protected health information confidential. You guys here on time every day, all day? Show up, do what you're supposed to do, did your homework, did your online assignment, did Monday's work? Maybe. You're practicing in school, so practice. But when you get a job, make sure do what is supposed to, even when no one's looking. Are you guys detail oriented? SIG codes, right? One little thing can kill a patient. Math, dosage calculation, one little decimal point. Poor notation can kill a patient. Yeah, it's that serious. On your externship, you're going to be processing scripts, filling meds, doing math. Are you confident not to kill? Because it might be your friend, your family member that you'll be dispensing meds to in the future. Trustworthy. Can I trust you with my Valium, my Vicodin, my Percocets, right? That's the dangerous substance. My expensive equipment. Do I want you touching my computers, my robotics in pharmacy? My IV hood, my machines. Right? It's all in training. So we can only let you do what we train you to do and what we document you as being able to do. Your competency. Health. So make sure you're in good physical, mental, and throw in spiritual health as well. Because a lot of times physical health will affect your mental health and then you'll make mistakes. If you're distracted, family, friends, boyfriends, girlfriend, preoccupied, you may make mistakes. And in pharmacy, what happens when you make a mistake? Somebody can die. In the hospital, they say about 100,000 deaths per year from errors, preventable errors. So you're more likely to die if you go to the hospital. Just kidding. I don't know the statistics, but it is dangerous because we are human. We make errors. Your job is to limit errors. Follow the procedures because there's built-in safety checks. Hygienes. Don't offend others. And also, that's an infection risk. If you're not bathing, you're infected, you're going to spread that. Coworkers and patients who are already sick, right? So it's even worse for them. You ever been in class with a stinky student? We all know who it is, but we never say anything, right? So it's okay. You guys can say something. If a student is stinky, let them know. Why do we wear scrubs? Yeah, it's our uniform, but why? So uniforms help us ID. Are you supposed to be here in the drug area? You don't have scrubs on. Are you supposed to be here in the hospital? So that's number one. The next is your personal protective equipment. Your scrubs are to protect you. So when you do lab courses with blood, urine, and feces, you want to be protected against exposure. Competency area, math. Did you guys view math 1 and 2? You're going to need to view it for week 1, day 2. We covered SICOs week 1, day 1, but for this one you got to view the math. It's fractions, decimal percentages. Do you guys know how to convert fractions, decimal percentages?
Haven't converted since high school.
Haven't converted, so watch the videos. It'll go over everything. And then when we open up week 1, day 2, just give it a practice. Okay? Terminology. So you guys are learning your SIG codes now, right? SIGNA means direction. SIG code is just abbreviation for direction codes, right? SIG codes. Terminology abbreviation. There are some abbreviations you can't use. Did you guys know that? Can you use this symbol? No. Can you use milligram, microgram like that? No, it looks like milligram, right? No trailing zeros, 0 in front of the decimal. So there's a lot of acceptable abbreviations and unacceptable abbreviations you should be familiar with. Computer skills, you guys are savvy enough. You guys grew up in that day and age. And then interpersonal skills between people. Most is communication. You will find that sometimes doctors, they do kind of have that God complex. And then sometimes nurses, you'll be able to pick out the good nurses versus the bad ones really quickly. But you got to work with them, so be cordial. Under HIPAA, what does PHI stand for? Private, protected, personal, patient, portable. Dun, dun, dun. We had this before. It is protected. PHI. A lot of P words. Make sure you know. Not private, not personal, not patient, not portable. Portable is here, but it's not PHI. Portable means you can transfer your insurance or keep insurance when you change jobs. Accountability, that's PHI, protected health information. Training and competency. So competency is if you know and if you can do the task. So not only if you know what to do, but if you can actually carry out the task. So a lot of times when they test you for competency, it could be an exam or an evaluation where you have to demonstrate. ASHP is one of the largest pharmacy organizations. They changed their name, but they didn't change the acronym, so that's why it stayed ASHP. American Society of Health System Pharmacists. You can become a member as a technician as well. And they do a lot of training, a lot of CEUs, continuing education units for recertification. When you have a job, who tells you what to do on the job? Your boss, your employer. The guidelines are set by the State Board of Pharmacy, the FDA, and everything else. So they do the guidelines, but what you do on your job day to day is set by your employer. So make sure you're familiar with drug laws, how much narcotics you can dispense. Get familiar with terminology, not medical terminology, but also terminology focused on pharmacy practice. How to read prescriptions, how to process them. We'll work on our math. Pharmacy has to do a lot of math, how much drug to give a patient based on their body weight, their age. Know their drug routes. We'll cover that in SIG codes, dosage form in SIG codes, infection control. So a lot of things. How to mix drugs, how to mix IVs, classification of drugs, how to do your inventory, retail or hospital, how to research information or use web sources, drug activity, that's kind of like drug classification. So a lot of things to be familiar with, and we'll cover a little bit of everything throughout your pharmacy series. So you have Pharm 107, 200, 208, 209, and Com 103. So 1, 2, 3, 4, 5 classes in your pharmacy series. After that, you guys can apply for your California license.
Are these usually like back to back?
It's whenever they're scheduled.
Ah,
Sometimes they are, sometimes they're not.
okay.
But the videos will always help you to refresh if you need them. Whenever you're finished. So there's a whole list. So if you look at the bulletin board right outside,
Okay.
there'll be a list of which classes you need to take before you qualify.
Okay.
Testing. So demonstrate knowledge from exams and or documented evaluations. So they'll put that all in your personal file, including your evals and any disciplinary actions. And with most personnel files, nothing can be removed or deleted. When you leave your job, don't burn any bridges, because if you return to that employer, everything's gonna be in your personnel file. Certification. Certification and registration are two different things. So it's very important. Certification, you are a certified pharmacy technician. Registration, you are a registered pharmacy technician. What's the difference?
One has a cert.
So here you took a test.
Okay.
So you just took a test from one of these guys. Pharmacy technician certification exam, or the exam for the certification of pharmacy technician. That's it. You took a test and you passed. That's certification. Registration, that's with the Board of Pharmacy. You must be registered to practice. So if you're not registered, you can't practice in California. So for you guys, you do not need to be certified. All you need is to finish your courses, get the affidavit from Eddie, your dean, and you will qualify because of your training hours in class. So you do not need to take the test. All you gotta do is apply. The test is available for you if you want it, just like all the other certifications. Now, if you are certified, you want to take the test, every 2 years you're going to need 20 hours of continuing education. So that's standard with most certifications. Your CEUs. Every 2 years, 20, at least 1 hour in pharmacy law. Comparing the two exams, the PTCE is more hospital focused, whereas the XCPT is more retail focused. So which one do you think is easier? Retail or hospital?
Retail.
Yeah. So this one's a little easier. So requirements are about the same, cost comparable, time, even the passing rate's about the same. You need about 75, 80% to pass. So it's not too bad, even if you opt to take the certification. Pharmacy technician certification renewal requires how many hours of CEUs, how often, and how many in law. So you guys are saying 20 hours every 2 years, 1 hour in law. You guys are correct. Now I think there's an additional requirement. I believe it's 2 hours in patient safety. Just double check if you are certified in renewing. All right, that brings us to the end of chapter 2. So let's work on week 1, day